sigue, sigue. El pueblo vive, vive. La lucha sigue, sigue. People getting their right to health care in the U.S. or what? And we found terrible, terrible, terrible stories. I don't need to tell them to you because y'all live in them. But I'll just share one of them with you. And we had one person whose story we heard. This woman went into labor. She went into a clinic. She happened not to speak much English. She was a Spanish-speaking woman. They put her in a room. They didn't talk to her. When she was screaming because she was in labor, they told her to shut up. They told her to shut up. When they got a translator for this woman, you know, you'd think, okay, we got a translator finally, let's talk, let's communicate. Do you have any allergies? Do you have any, what are your symptoms? The usual triage kind of stuff. What did they ask? What did the translator ask? Are you on Medicaid? Do you have insurance? Is that the human right to health care? No! What is the human right to health care? The human right to health care is universality. Universality means no one excluded. I don't care if you're black, white, man, woman, whatever you may be from green, yellow, I don't care the color of your skin, and I don't care about whether you can pay or not. We're not going to exclude anyone based on an inability to pay. We're not going to exclude anyone based on prior existing conditions. That's what the universal principle of the right to health care means. The second principle of the right to health care is equity. Everyone deserves an equitable share at the table. If you're from a rich community, I'm sorry to tell y'all rich people, you're going to be paying more. Yeah. Because everyone's going to be getting the same health care. If you're from a poor community, you have to pay less. And if you actually talk about access, we're talking about a sliding scale starting at 0, so that no one is excluded. And the last principle is accountability, which means it's up to these folks in the building behind me. It's up to the folks over there on 16th Street, 16th in Pennsylvania. It's up to Barack Obama. It's up to the Supreme Court. It's up to the United States Congress to ensure that everyone's human right to health care is met. And what that means often is government paid for, sometimes even government provided, insurance and a government health care plan. And what that is single payer. So we're here to tell you we Amnesty International, we don't get into the specifics, the different ways of doing things. But whatever health care program we get has to meet these three principles: universality, accountability, and equity. And that's the only way we're going to get the right to health care achieved in this country. Thank you very much.